Hi, I'm Rick Saxen, clinical lipidologist and head of the lipid clinic at South Dayton Acute Care Consultants, and we're here to talk about a topic that's near and dear to my heart, cholesterol. As a lipidologist, I work with patients to help manage their cholesterol, and many people find the topic of cholesterol to be pretty overwhelming. That's because there's a lot of information out there, and a lot of it is conflicting, and it's hard to know how to distinguish between the various sources of information in order to get good information. So I'm here to offer you two pieces of good news. The first is that if we dig a little deeper below the surface, the concept of cholesterol is actually fairly manageable. And the second piece of good news is that there's things that you can do today to help improve your cholesterol. So we're going to be doing a fairly deep dive into the world of lipids. We're going to find out what they're doing in our body, why they're there. We're also going to say, okay, well, I go to the doctor's office, I get my blood drawn, and it spits out these cholesterol numbers. What the heck do those even mean? And more importantly, why should I care? And finally, we'll touch on, if my cholesterol is high, what should I do about it? So what are lipids? Well, strictly speaking, lipids are organic molecules, meaning that they're molecules that are found in nature and generally produced by living things. They are made of a carbon backbone, which nature puts together almost like Legos to build bigger structures. Now, what distinguishes lipids from other organic molecules like proteins or carbohydrates is that lipids don't dissolve in water. And any of us who have cooked with oil or who have cleaned up dishes after cooking, notice that the fat floats on top of the water. And that's exactly what we're looking at with lipids. There are many types of lipids in our body, and we're going to focus on just two of them. The first being cholesterol. So here is the picture of the structure of cholesterol. And I don't want to get too bogged down into the nitty-gritty of how the structure is put together, but suffice it to say that cholesterol is made up of 4 different rings of carbon with a long tail sticking out the side. And the structure of cholesterol makes it perfectly suited to do the jobs that it's supposed to do in your body, which we'll talk about here in a second. The other lipid that's important is something called triglycerides. Now, triglycerides, you can see, look very different than cholesterol. Triglycerides are made up of 2 parts, the first part being a glycerol backbone, and then there's 3 fats sticking out the bottom. I imagine triglycerides to be somewhat like a coat rack hanging on a wall with 3 hooks and 3 scarves hanging down, where the hooks are the glycerol and the scarves are the fatty acids that are hanging down. And just like you can have scarves of different lengths, different styles, shapes, etc., all the fats can be different when they're hanging off the glycerol. But if you have 3 scarves and you have 3 hooks, you got yourself a triglyceride. So what are these triglycerides doing in our body? Well, triglycerides are there to provide our cells with energy. It's a very efficient source of fuel that our cells burn to create energy. So triglycerides are made in the intestines from the fat that we eat, and they're also made in the liver. And they're transported into the bloodstream, and they float around delivering energy to the various cells that need it. Big users of triglycerides for energy would be cells like our muscles and our heart. Any extra energy left over that's not needed by ourselves can be stored in the adipose tissue as fat to be burned later when we need it, or it gets returned to the liver for recycling. Cholesterol, on the other hand, does something very different. It doesn't provide energy at all. It is mostly a structural component of our cells. So every cell in our body has a shell around the outside of it called a cell membrane. The cholesterol is a very, very important part of that cell membrane that is essential for the proper functioning of the membrane. So essential, in fact, that you need exactly the right amount of cholesterol for it to work properly. Too much or too little becomes toxic to the cells and can actually injure or even kill the cells. The cells find it so important to have the exact amount of cholesterol that they have tightly regulated mechanisms to keep that amount specific so they don't have too much or too little at any given time. In addition to structure, cholesterol can also be a building block for other important molecules in our body like vitamins and hormones. If I was to show you a picture of vitamin D or testosterone or cortisol, they would look very similar to cholesterol, and that's because they started out as cholesterol and then were made into those vitamins or hormones. Similarly, your liver can turn cholesterol into something called bile and secrete it into the intestines when we eat, and it helps our body digest fat properly. Now, I told you a minute ago that fats don't dissolve in water, and as it turns out, our blood functions very much like water. So how is it that we can move lipids throughout our bloodstream? Well, our bodies have evolved very clever ways to solve this problem. They actually pack the lipids into a little bubble called a lipoprotein because it's made up of lipids and proteins. And this bubble in the core, they pack in all the cholesterol and the triglycerides, and they coat it on the outside with something that can be dissolved in water. And then they can put it into the bloodstream, and it floats very easily dissolved in the water. So as the lipoproteins float through our bloodstream, the triglyceride is taken out and they become denser as they move along. So our liver will make lipoproteins that are very low in density, and they're appropriately named VLDL, very low density lipoprotein. And as they flow through the bloodstream, they become denser and they turn into something called LDL, or low density lipoprotein. And that's something that I think many of us are familiar with from when we get our cholesterol checked at the doctor's office. So here's a schematic of the VLDL floating through the bloodstream, and it delivers the triglycerides to the tissues that need them for energy, turns it into LDL, and goes back into the liver for recycling. Now, the essential point here is that the LDL is not providing cholesterol to the cells. And why is that? Well, we talked earlier about how essential it is to have the exact amount of cholesterol in each of the cells. So the cells don't want to rely on any extra source of cholesterol. They want to keep all the control for themselves. They make every single bit of cholesterol that they need. In fact, if they have too much cholesterol, they dump it back into the bloodstream. So I think of the LDL cholesterol particles as much like spent garbage bags that are returned to the dump of the liver for reprocessing. The reason this is so important is because when we use cholesterol-lowering medications to lower the amount of cholesterol in our bloodstream, we can feel reassured that we're not injuring the cells because they don't give a hoot how much cholesterol is in the bloodstream. They can make all the cholesterol they need for themselves. So when we go to the doctor and we check our cholesterol, what do those numbers mean and what are they telling us? Well, a standard lipid panel that you'll get at the doctor's will have a couple of components. It will have your total cholesterol. It will have your triglycerides. It will report out your HDL cholesterol, your LDL cholesterol, and sometimes a VLDL cholesterol as well. So what are those numbers and what do they mean? Well, here's a cartoon of our bloodstream. And as you can see, it has the LDL and the VLDL bubbles that are floating through the blood. And if I was to take about 6 or 7 tablespoons of your blood and chop open every single one of those bubbles and pour out the cholesterol and weigh it, that's the total cholesterol. So the number that you're getting is simply the amount of cholesterol contained in all of those particles in about 6 or 7 tablespoons worth of blood. Similarly, if I was to do the same thing for your triglycerides, break open all those particles, weigh the triglycerides, that's the amount of triglycerides in 6 or 7 tablespoons of your blood. Interestingly, the VLDL and the LDL numbers are typically estimated, and that's very important to understand that these are not directly measured. There are ways to directly measure it, but most of the time our lab will just estimate it for us. So now, what does our cholesterol panel not tell us? Well, to answer that question, I want to look at these 3 clowns on the screen. And if I was to try to describe these clowns for you, it's by telling you only the amount of air in the balloons. You would have no idea if I was talking about the clown on the left, which has 1 giant balloon, the clown in the center, which has 3 medium-sized balloons, or the clown on the right, which has 7 small balloons. Because the amount of air contained in the balloons would be the same for each of the 3 clowns. Similarly, if I was to tell you just how much cholesterol is in your bloodstream, you don't really know if you have large pockets of cholesterol, like the clown on the left, or if you have many of the small pockets of cholesterol, like the clown on the right. And the reason that matters is because the clown on the right is actually much more risky for developing heart attacks and strokes than the clown on the left. Now, the good news is the total amount of cholesterol tends to track very nicely with the amount of particles in the bloodstream, but there are some conditions like insulin resistance or diabetes which make that relationship less reliable. So it's important to talk to your doctor about whether more testing might be necessary to figure out which of the clowns best represents your cholesterol. The other thing our cholesterol panel does not tell us is how much cholesterol is in our brains. And this is important because our body treats our brain very much like a fortress. And like every good fortress, it has a wall around it. And in this case, the wall we call the blood-brain barrier. It's an impenetrable wall that won't allow our lipids or lipoproteins in. Our brain, just like the rest of the cells in our body, takes total control of the amount of cholesterol there and is not relying on any delivery of cholesterol from the blood. Again, this is important because if we lower blood levels of cholesterol, our brain will be doing just fine. There's a lot of misinformation on the internet that if you lower cholesterol too far, it causes problems like dementia or those types of things. And not only does this not make sense physiologically, but research has shown this to be not true as well. Now, let's talk about HDL cholesterol. In the past, HDL cholesterol typically has been referred to as the good cholesterol. Why is that? Well, in large population studies, researchers observed that people with higher levels of HDL cholesterol had less risk of heart attacks and strokes. And so it stood to reason to say, okay, well, that HDL cholesterol must be doing something good. Based on that theory, drug companies developed several drugs to actually take people with low cholesterol and raise up that HDL cholesterol. But unfortunately, it did not result in a lower risk of heart attacks and strokes. So it sort of put into question this idea of HDL being the good cholesterol. So what's going on here? Well, as it turns out, there's sort of a teeter-totter type relationship between HDL cholesterol and triglycerides, such that when HDL cholesterol goes up, triglycerides go down and vice versa. And in the past, when we thought of HDL as good cholesterol, what it probably means is that triglyceride levels were low, and that more likely accounts for the lower risk of heart attacks and strokes in people with high HDL cholesterol. So why should I care? Well, let's go back to the cartoon that we looked at earlier with the VLDL particles and the LDL particles that are floating through the bloodstream. As it turns out, when these particles are floating through the bloodstream, what can happen is that occasionally some of these particles can get lodged in the wall of the artery, and they get stuck there. And what that is the first domino in a long chain of events that ultimately leads to heart attack and strokes. As you can see here, the blood vessel on the top is a nice, wide open blood vessel, easily delivering blood to whatever tissue it's supplying. But let's look at the bottom artery. It looks very, very different. So imagine that artery trying to deliver blood to the muscle of your heart. Well, at that narrow point there, the blood is not getting where it's supposed to go very easily, and sometimes people can experience symptoms like chest pain or shortness of breath. If that artery closes up enough or closes off entirely, it can actually injure the heart muscle or kill the heart muscle, and we call that a heart attack. If you look very closely at what's making that artery narrow, it's cholesterol inside of there. So we need to be mindful of our cholesterol levels and lower them down so that they don't get lodged in the walls of our artery and ultimately lead to processes like shown here. So what can I do about this? Well, first and foremost, the most important thing you can do is get your cholesterol checked. If you don't know what you're starting from, you have no idea what your risk of heart attack and strokes is. So talk to your doctor, get your cholesterol profile checked. Once your cholesterol panel is checked, you can also talk with your doctor and see where it puts you on the spectrum of risk. Different cholesterols put people at different risk of heart attacks and strokes, and it's important to know where you're starting from. I'm a firm believer that if something can be measured, it is also something that you can change. So what can you do to change your cholesterol? Well, as any good lipidologist will tell you, the first thing and the most important thing that you can control is what you put into your body. So let's talk about some dietary things that you can do today to lower your cholesterol. The first thing is to reduce the amount of saturated fat that you eat. What is saturated fat? Well, the easy rule of thumb is if a fat is solid at room temperature, it probably is high in saturated fat. So think of things like your animal fats, butter, cream, cheese. Those things are solid at room temperature and they're very high in saturated fat. And now that's compared to things like oils, which are liquid at room temperature, which tend to be lower in saturated fat. The second type of fat that you want to avoid altogether, if possible, would be something called trans fats. So trans fats are typically not found in nature, and they're a byproduct of a lot of our food processing. They are very unhealthy. They do many bad things to your body, including raising up your cholesterol. So if at all possible, avoid trans fats altogether. Thankfully, nutrition labels do report out the amount of trans fats contained within foods, and so it should be pretty easy to tell which foods have it and which foods do not. The second type of food you want to avoid, if at all possible, is sugar. So sugar, much like the trans fats, do lots of things to our body that is not healthy, and one of which being raising up your triglycerides and sometimes your LDL cholesterol as well. Also, like trans fats, nutrition labels are now required to tell you how much sugar is added to the food rather than just being contained within the ingredients of the food itself. So you want to try to limit the added sugars in your food to as near zero as you can. Admittedly, that's hard to do in our American food supply, but trying to get it as low as possible is key. So those are some things to avoid. What should we be eating? Well, I want to be careful and distinguish sugar from other types of carbohydrates because other types of carbohydrates are not necessarily bad at all. Specifically, fiber. Fiber is an excellent nutrition source in our body, and we really should be getting as much fiber as we possibly can. Fiber does a lot of healthy things, including promoting our gut health, feeding our intestinal bacteria. It also makes us feel fuller when we eat so that we don't eat as many calories. It also slows the absorption of fats and sugars into our bloodstream, which is beneficial as well. We should be trying to have as much fiber in our diet as possible. Many of our processed foods are high in sugar and low in fiber, and we want the exact opposite, foods that are high in fiber and low in sugar. So what are our sources of fiber? Well, grains. Grains are an excellent source of fiber, but it has to be whole grains. As grains are processed and refined, much of the nutritional components, including the fiber, is stripped out of those. So look for sources of whole grains like brown rice, whole wheat, corn, etc. Lentils, beans, other legumes are excellent sources of fiber, as are fruits and vegetables. That brings us to another important food group, fruits and vegetables. It is very hard to overdo the fruits and vegetables. Fruits and vegetables not only are an excellent source of fiber, but they also contain a lot of other vitamins and nutrients that are very useful for our bodies. And we should be eating as many fruits and vegetables as we possibly can. Lastly, we should increase our intake of oily fish, nuts, and seeds. These are great sources of beneficial fats for our body and tend to be very low in saturated fats. Finally, talk to your doctor about whether cholesterol-lowering medication might be right for you. Folks that have elevated risk of heart attacks and strokes based on their elevated cholesterol may not have enough cholesterol reduction just from dietary changes alone and may need additional medicine to reduce their cholesterol on top of that. There are lots of different medications out there, and your doctor will be able to help you decide what would be right for you. Hopefully that gives you a better idea of what lipids are and what they're doing in our body, and also may demystify some of the numbers that you're seeing when the doctor checks your cholesterol. More importantly, I hope you have a better understanding of why it's important to know what your cholesterol numbers are and what are the steps that you can take to help get control of your cholesterol. And lastly, we'll leave you with this thought. In the past, medicine tends to have focused on taking people who are suffering from a disease and help mitigating the impact of that disease on their lives. I think the future of medicine is taking a personalized approach to hopefully prevent or delay the onset of chronic disease so people don't suffer in the first place. That concept of prevention and maintenance of health is captured very nicely by this quote by the Vietnamese monk Thich Nhat Hanh, who says, Keeping your body healthy is an expression of gratitude to the whole cosmos, the trees, the clouds, everything. I think that summarizes very nicely the interconnectedness of the universe and our place where our health fits into that. So I'd like to thank you for listening today. If you have any questions about your cholesterol, please don't hesitate to give me a call at the Lipid Clinic at SDACC. I'm always happy to talk about your cholesterol or just lipids in general. Thank you very much.